Does anyone you know suffer from inflammatory bowel disease or have any related symptoms? Or maybe are you suffering from this illness? Sometimes IBD may vary among different people. Maintaining to have a proper lifestyle and eating habits would be challenging because of the inconvenience IBD causes. So we are here today to give you a short guide on how to manage IBD. The disorder Crohn's disease and ulcerative colitis are included under the umbrella term of inflammatory bowel disease or IBD. This is defined as a persistent inflammation of the gastrointestinal or GI tract, and long-lasting inflammation causes GI tract damage. Inflammatory bowel disease's precise causes are still uncertain. Stress and food were once thought to be contributing factors to IBD, but doctors now understand that they do not really cause the condition. Immune system dysfunction is one potential factor. An aberrant immune response leads to the immune system to assault the cells in the digestive tract when it attempts to combat an invading virus or bacteria. IBD appears to be more prevalent among persons who have family members who have the condition, which may be related to heredity. However, this family history is not present in the majority of IBD patients. The long-term health effects of malnutrition in IBD range from anemia and bone diseases like osteoporosis to Crohn's disease and ulcerative colitis. Before we continue, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now off to our discussion on diet management for people with IBD. Finding the right diet may be challenging since IBD or inflammatory bowel disease affects the intestines. IBD can result in nutritional inadequacies, appetite loss, excessive weight loss, eating less to manage symptoms, and having no appetite overall. These variables are frequently more prevalent during a flare. Dietary management of inflammatory bowel disease frequently focuses on maximizing nutritional status, minimizing malnutrition, and symptom control, which may involve avoiding particular foods that can aggravate symptoms. IBD patients require personalized diets rather than a universal one, as a result of the fact that every person might have unique symptoms, dietary tolerances, prescription needs, illness sites, and lifestyles. It is simpler to eat properly while you are in remission, which is when your condition and symptoms are successfully managed with medication and/or other therapies. It is advisable to concentrate on eating a balanced diet that is rich in variety and health benefits so that you don't require a lot of supplements. Most micronutrients, with the exception of vitamin D, may be obtained in sufficient amounts from the diet. Nonetheless, you may still need to take a supplement or two. The International Organization for the Study of IBD recommends that people with IBD consume a balanced diet and avoid trans fats, artificial sweeteners, and processed goods. When you are in remission, you do not need to limit yourself to any particular dietary category. However, some individuals do link certain dietary items and serving sizes, such as eating a lot of raw lettuce, to worsening symptoms. If this applies to you, you can avoid certain items. But if you're cutting out a lot of foods from your diet, talk to a nutritionist to make sure that you're not losing out on too many nutrients. When your stomach is inflamed, consuming a lot of fiber may hurt and exacerbate your symptoms. But when you are feeling good, attempt to raise your fiber intake because fiber is crucial for maintaining remission. According to some data, fiber benefits commensal gut bacteria. This causes the formation of short-chain fatty acids, which have been found to enhance salt and water absorption in the colon and aid in mucosal repair. Even in remission, it would probably be beneficial to follow a longer-term low-fiber diet if you have a chronic structural condition such as luminal constriction or partial bowel blockage. This is to stop additional obstruction and gut discomfort. Probiotic-rich foods, which are fibers that nourish the beneficial bacteria in the gut, can aid in reducing inflammation and re-establish the function of the mucosal barrier. Foods that are highly recommended are tomatoes, onions, bananas, oats, garlic, beans, and oatmeal, which contain quite a lot of probiotics. Due to the fact that Crohn's disease and ulcerative colitis are inflammatory illnesses, it may be beneficial to concentrate on consuming anti-inflammatory foods, particularly cruciferous vegetables, citrus fruits, green tea, and healthy fats, like those present in fish, nuts, seeds, and avocados. To build up your strength and be well nourished when in remission, it's crucial to eat enough nutrient-rich meals and exercise. To assist manage symptoms like nausea, loss of appetite, diarrhea, and intestinal discomfort while you are suffering from an active illness flare, you may need to alter your diet. While no one food group or one food item may be definitively linked to bringing on a disease flare, some meals may be more likely to aggravate the gastrointestinal tract. Reducing your consumption of nuts, peanuts, popcorn, and raw vegetables might assist with symptoms, since insoluble fiber can aggravate an irritated stomach. Additionally, processing food in a way that makes it simpler to digest might be beneficial since an irritated stomach has greater trouble digesting and absorbing nutrients. Cooking, blending, and grinding your food can definitely promote mucosal healing, reduce gastrointestinal irritation, and improve nutrient absorption. During a flare, you should remember to consume extra protein to promote recovery. Eggs, for example, are a simpler form of protein to digest. Although lactose intolerance is not more frequent in those with IBD, it is nonetheless a fairly common condition. Therefore, limiting dairy products may be helpful if you feel any bloating, stomach discomfort, or diarrhea after consuming lactose-containing meals. Eating extra soluble fiber and foods like bananas, oats, and applesauce can help minimize diarrhea. There are several basic dietary guidelines to assist control gastrointestinal symptoms during a flare. Electrolytes lost due to diarrhea can be replaced by drinking homemade oral rehydration treatments. Try eating small meals more frequently if your appetite is weak and you are having difficulties eating enough. For patients who are malnourished and have an active illness, enteral tube feeding or liquid nourishment administered through a tube is an alternative. For people in remission who struggle to consume adequate calories through oral means, L-glutamine is an amino acid that improves immunity, maintains mucosal function, repairs epithelial cells, and suppresses inflammatory reactions. Consequently, you could benefit from taking these supplements. Other food items can include fish oil, which has other omega-3 fats, and other omega-3 fats, which are anti-inflammatory and can be a healthy supplement to the diet. However, they are not recommended for maintaining IBD remission. Your fundamental micronutrient requirements can be met with the aid of a daily multivitamin. Again, probiotics are beneficial for treating IBD, as you may have heard. However, there isn't a lot of solid proof for this at the moment. There are select items for ulcerative colitis that have shown promise. Nonetheless, doctors advise against using probiotics when Crohn's disease flares up. This is because having bacteria in your blood called bacteremia increases your chance of developing it. Before incorporating any supplements into your regimen, consult your private doctor. In the control of the immune system, vitamin D is also crucial. The majority of IBD patients should take calcium and vitamin D supplements, and their blood levels of vitamin D should be regularly checked. Zinc malabsorption can be brought on by inflamed tissue in the small intestine. It can result in a zinc shortage throughout the body. This zinc shortage is also more likely in those with ostomies, fistulas, or more than 8 watery stools per day. If you have any of these symptoms, your doctor may advise taking zinc supplements. If you have an inflammatory bowel condition, it is crucial to eat healthily in order to replenish your vitamin and mineral stores, build up your strength, and gain weight if necessary. You might not be able to eat regularly when experiencing a flare, but it's a good idea to concentrate on wholesome foods that won't aggravate your symptoms. It's possible that you'll also need to take vitamins. And that concludes our video on how you can manage your diet and eating habits if you have IBD. Be reminded that this video is primarily for information, and we do not claim to provide medical advice tailor-suited to your needs. Always review the facts with your own private doctor and nutritionist to get healthcare that is personalized to your needs. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later, and thank you for watching.